Hello viewers, welcome to this week's episode of Health Watch on Advent Cable Network Nigeria. I am Angela Mweze. Coronavirus, also known as COVID-19 infection cases, is still on the rise. As at now, there are over 5.6 million cases and over 350,000 deaths recorded globally. Out of this, a little above 2.9 million infected patients have mild condition and over 2.5 million persons have recovered and have been discharged. However, there are still some over 50,000 persons who have serious cases or in critical condition globally. Africa, amongst other continents, still records the lowest confirmed cases with little over 92,000. As at now, Nigeria has over 8,900 cases, which is an increase of over 1,400 from last week. This has put us as the fourth most impacted country on the African continent. It comes behind South Africa, Egypt, and Morocco. Out of these numbers, still speaking about Nigeria, there are over 6,000 active cases and 259 deaths. However, a total of 2,592 persons have recovered. With all these statistics, there are still a lot of persons who do not believe that coronavirus infection is real. On the program today, we have quite a lot of information for you. We will understand the reality of COVID-19 in our communities. We shall understand the issues surrounding the hydroxychloroquine. We shall also be enlightened on some methods of boosting our immune system to help our body fight the infection, and how to stay safe even as governments across the globe are planning to gradually ease the lockdown. You don't want to miss today's program. I have two guests on the program today. The first to my right is Goodwill Uwefi. He's a public health commentator. You're welcome to the program.
You.
It's good to finally have you here.
Thank you.
You're welcome. And across me is Miss Chidera Ezako. She is a biochemist with a master's in public health. She's presently working with the COVID-19 response team, FCT, with the Public Health Department. Miss Sidea, you're welcome to the program.
Thank you very much.
You know I'm used to calling you Sidea, so it has come out at the moment. Thank you. You always have a busy day, so it's good to have you here.
Thank you very much
for coming.
Thank you.
So, in my introduction, the cases are still rising in Nigeria, but there are still people in Nigeria presently who do not believe that there's anything like coronavirus. Let me even start. I think after our last program, somebody called from some part of Nigeria, and the person said, look, in my area, people are just living their life normally. They don't even know there's anything happening. They're just okay. They think coronavirus is an issue with the government, or maybe something the government have put out so that they can eat more money. There's just so much going on there. But you are in the field, you meet this every day, you take samples every day. What has your experience been like?
Thank you very much. First of all, I'd just like to debunk the myth that COVID-19 is not real. COVID-19 is very real, and from the field work that we have been doing, I can say that, at the moment, I've come in contact with people who have turned out to be positive of COVID-19. Some of them being asymptomatic, that's having no symptoms, and some of them quite symptomatic.
So they're walking around without symptoms, but they don't even know that
they're carrying it. Yes, I think there was a case where we were just, in the community doing community search, and one of my colleagues just saw someone on the road and was like, and told him, please come and do your test. And he said, okay, no problem. Did the test, and the next few days we came back to that community and we saw that he was being evacuated because he was positive. Now, this was just somebody who was walking on the street who had passed so many people and maybe had conversations without even knowing that he was positive. And the rate of transmission would have been very, very high. So in that case, I can say that COVID-19 is very real. Just that it might not be as visible as we think. Maybe we might believe that people might just be coughing and maybe vomiting and things like that, but many people are actually asymptomatic. They're not showing any symptoms, so it is quite hard, and I think that's one of the challenges that we're actually facing in the field.
Let me also ask you, these communities, because really I'm surprised that some people actually believe it's for the elites. It's people in the highbrow region of the FCT that would come down with this. Since you had even somebody who was the former
Chief of Staff
to the president. So it's looked, and then they had another politician's son. They would think it's from that. But what kind of communities do you work with? The communities in the highbrow area, is that the only place you find cases?
No. We go everywhere in Abuja, starting from, I'll give examples like maybe Utako. We've gone to Pape. We've gone to Aleta.
These are communities.
These are communities
deep from the city.
Yes, away from the city center. We've gone to places like I think we've gone to Kwali. We've been in Gwagwarada. We've been in I can't remember them at the moment, but we've actually gone to so many communities. Dakibiu, yes. We've gone to places that I've not even seen before. Places like Paduma too. We've gone to those places, and even if all of them don't turn out, like don't have positive cases, but I know some cases they have actually turned out to be positive. I think especially there's a place of Mabushi.
But does it vary? Are there areas that you have more concentration from your experience, or it just spreads across?
It's just sparse. Maybe you get 2 here, 2 there. Some things like that, but not basically that there's a bulk of positives in a particular area. So it's just actually spread about.
And what's your experience been like as well?
Well, it's a viral infection, so that means the spread will be much. Because viruses are very small, even far smaller than bacteria. It's difficult for people to really understand that it's real. You also know that Nigeria is a developing country, and our level of literacy and education is not there yet. One of the ways we could help people understand the realities is what we're doing now, talk about it. Yes, there are government lapses here and there, but generally COVID-19 is real. And with the education, with the communication, with all the public health emergency tools that are being used, mitigation tools, contact tracing, treatment, testing, and so on, gradually it will wind down. It's important we stress that for viral infections that are spread through aerosols, that is discharge through air particles, the chances of it just going away immediately wouldn't just happen overnight. So government has to realize that there has to be a long-term planning, and people also need to know that we may be with this for some months, for some reasonable months. And one of the things we need to begin to look at is how to live and manage the pandemic. So it means that in as much as we're going to be practicing social distancing, using of masks, hand sanitizers, we also need to know that at some point it will not be feasible for all of us to stay at home. We need to come out. But what we'll be trusting is that the public health tools being used will mitigate the spread. So we don't feel the shock. People would still get the infection, but we wouldn't be in a situation where we're so scared that we can't do anything. Because if we remain locked down in the house for the next 4 months, based on the behavior of the virus, the scientific modeling is not going anywhere.
So we have to deal with the situation.
Absolutely.
It's already here with us.
So we're going to look at ways to manage the crisis, look at ways to treat, isolate, educate, and then look for ways to maybe develop preventive or prophylaxis treatments.
But I'm now thinking, are we doing enough? Are we passing out enough information? Are we giving out enough? Are we educating people, much? Because the fact that you don't have any symptom doesn't mean that you're not carrying it.
Yes.
You could be carrying it and distributing to so many people,
Yes.
to your family.
Yes.
So that's why it's important. People should not think that we are not dealing with anything because they are okay. They find out in their community nobody, but they could be carrying it, and then one case might be really bad. So do you think we are actually passing out enough information to especially the communities? Let me start with you.
Well, for urban communities, that to an extent, you could say 40 to 50, 60%. Because people have access to mobile phones, TV and so on. For rural communities, gradually. But you also need to know that some of the information that has been mainly focused on the disease is real. If you have it, go this. But as time goes on, government has to talk about ways to help yourself. If, for example, you have it, supportive cares, things you could do. Because at least 90 to 95% of people who contract it never show symptoms. And then if you could isolate the elderly, some with pre-existing conditions. When you use the word prevention, means if you have underlying sicknesses that you've been suffering from, maybe diabetes, asthma, and so on.
Yeah, that has to do with your lungs,
or some sensitive organs, cancer and all that. You are more likely to be more predisposed to adverse effects of the COVID-19 infection. But as time goes on, we need to talk about how people could manage some of these issues. Because even if you take all the preventive measures, because of our day-to-day going out, and the infections will still spread. And that is why in Korea they had to shut down the schools, because they had a spike in cases. And this will continue for some reasonable months.
So we should expect, if there are cases, you're noticing the cases going on.
Why not?
We might go on lockdown briefly and maybe
not really.
Contain or something.
We need to look at other options, like talking about ways people could keep themselves, provide themselves supportive care, like taking prophylaxis. Because when you have a pandemic that has no cure, if you remain on lockdown for 6 months, it's not feasible. So each time there's a spike and you say, okay, no. So for example, if people who have corona stay indoors, take basics, supportive care, take the right kind of fruits, take the basic treatments, rest enough, they will recover. But for those who are likely to have more adverse effects, they can be isolated, kept. In fact, for most of the Western world, most of those who had corona were asked to stay at home after 14 days, and then you take another test. So there are some of these tools that are still being talked about behind the scenes, but they need to be, we need to focus on supportive care. How can you get the large number of populations, even if they are infected, to still remain fit and not spread the virus?
So what just wanted to ask you, you and the field, and I wanted to find out what's the procedure with checking somebody. Is it somebody they come to meet you, or you go to find them, or you put out a random questionnaire and then you pick from it? Because some communities don't even have address, so I don't even know how you're going to locate these people. So what's the procedure with checking, people?
Aside from community testing, if it's a home search, basically it starts with maybe an individual or somebody who is living around there, calling the NCDC toll-free number.
So people
calling to report cases of themselves or a suspect case, maybe somebody in the neighborhood or someone that they are really suspecting and doesn't want to get tested, something like that.
So people actually call in and somebody responds to the number?
Yes. So they respond, and then the NCDC calls in to the public health department, and then from the public health department they send out teams in the response team to go to the particular address and get the sample taken, and from there the sample is taken to be to be run at the NRL, that's the National Reference Laboratory, that's for NCDC. Then after that, the result is gotten and sent via text message. If it's negative, sent via text message from the state epidemiologist to the person. But if it's positive, then there'll be an evacuation, but they will call ahead of time to tell you that your result has been
positive.
They tell you you're positive. They tell you, okay, prepare your, just know what to do at home, prepare your house, make sure everything is in order, because we'll be coming to evacuate you. And then you're...
So it's not a random thing, like nobody tells you anything, they just carry you and...
It's not random, but then sometimes due to contact tracing, especially if the individual has been tested positive, contact tracing would then make the teams to go out to the contacts who have been in contact with the person. Yes, so that's how most of the searches are done.
Okay, maybe because I know this has been talked over and over and over again, but I just want us to stress a little bit on the symptoms. If you notice, and then I think at some point we'll also call the number that you can call, to if you notice some of these symptoms, please call. Don't just sit down and assume that it's catarrh because they have similar symptoms. So do you want to go over the symptoms? Let me just...
Okay, I could. A fever that is more than 38 degrees.
Okay, so you're measuring your
You're measuring your temperature, more than 38 degrees. If you have persistent cough, persistent dry cough. Now, sometimes maybe you've not drank water in the whole day and then you just cough and dry cough. That doesn't mean it has to be persistent. Runny nose, that's catarrh. Maybe a sore throat. And then shortness of breath, that's difficulty in breathing. Sometimes vomiting or nausea or even diarrhea. And then there's a loss of taste and loss of smell. Then there's general body weakness that malaise feeling. So things like that.
At this point, isn't it getting a bit close to the danger time?
Yes.
You shouldn't
so immediately you notice such.
Yeah, but
you know that you need to do a test.
Need to do a test.
But of course, people don't need to wait for that. You may also see if you have somebody you've been exposed to somebody who had COVID-19, of course you could also
reach out to them.
Yeah, so if you've been exposed in any way or you think you have been exposed, then there's a testing center, is the ICC center. There's an ICC front desk number that you call in and then they give you a code. You're coming at the day you're supposed to. So there's a team there every day from 9 a.m. till at least 5 p.m. who is there for testing at every point in time.
So you don't go to every hospital for it?
No.
You don't walk into any hospital around your area? You just call the numbers, we'll put up the numbers.
Although now we want to sort of decentralize it so that the bulk of the work won't just be on the public health department. So there's sort of a... What's the word now? Yeah, there's a plan, yes, thank you, to decentralize into every hospital and then primary health cares too, so that especially for places that are really far from the city center, yes.
But that is not done yet. That
well,
has not been put.
It's in place somehow, yes.
But when it comes, I'm sure we'll be able to pass it on.
Yes.
But the important thing is that if you have persistent cough,
yes,
you've been coughing, dry cough,
yes.
So when you talk of dry cough, you're not bringing out any
sputum. But it has actually been noticed that even if it's dry cough, sometimes at the end of it all, there's a sort of sputum that is actually comes with it. But at least it starts with a persistent dry cough, and then if you have a fever
of over 98 degrees.
So if you have a fever and cough, you should basically go for a test. Now, if you walk into any hospital, they would advise you to go for a COVID-19 test. Yes.
Okay. And then sore throat, if you have a bit of sore throat, loss of smell and taste, very important. Then what is shortness of breath?
Yes.
And when you talk of shortness of breath, that is you're not breathing fully.
You find it hard to breathe at a regular pace.
At a regular pace. Okay, then you should.
And sometimes when you have shortness of breath, you can't move. People so they can stand up
for a long time. Okay, so you need to go but if for the ones that might not have symptoms, if you have been exposed by any chance, maybe you've been in a place where somebody it's good to.
Yes. But sometimes, even if you haven't been exposed and you just want to know your status, you can actually call the ICC center.
Okay, really,
there's no payment, it's free. Just walk in, get you tested.
There's no payment, it's free.
Very free. Nobody's going to.
Okay, this is for FCT. I'm sure that should apply to almost every other centers around Nigeria, because I've not heard anybody pay any money.
No,
for the test, it should be free. Yes. Okay, so we've talked a lot about that, and thank you, well done.
Thank
well
you
done for standing in the front line. These people that are not bold, at least you're bold. So that's good. Thank you. Thank you. So now I want to talk about hydroxychloroquine. For a very long time, from the very beginning, from the beginning of this coronavirus, when we started hearing about it, there was a time it just came out on social media that the treatment, and next thing, chloroquine in the market disappeared off the counter because people were rushing to take it. That was the treatment at that particular time. But then after some time, there have been issues back and forth. Is hydroxychloroquine for treatment? Is it good for treatment? But recently WHO comes on to say it's discarded, it has stopped the trials, because it's not safe. But Nigeria, according to the NAFDAC boss, the DG of NAFDAC, she said we will still continue with our trial because there are also considerations. So what's going on with hydroxychloroquine? Are we supposed to be looking at this as a treatment? Because I'm thinking of safety. After we've been using it for years, how come it's no longer safe to use?
That's the uniqueness of science.
Okay.
Science is very skeptical, and because the chloroquine issue has been either political or contentious, some people are really taking a critical look at chloroquine. But most of the studies that has validated the need for chloroquine has focused on the early stages. The work by Dr. Didier Raoult, a French public health specialist in Marseille, and some of the work done in China in February, March. However, those who are against the use of chloroquine has been basically on the safety. In Africa, most people use chloroquine because we know malaria, and for the past 50 to 60 years it's been used. In the western part of the world, that's not often the case, except if you're traveling to Africa. So let's say as a prophylaxis. So the safety issues are bound to happen in those parts of the world because they're not used to the drug. One has to look at the concentration of the chloroquine used. If chloroquine is used somewhere around the range of 600 milligrams, it's a little bit toxic. However, if you have chloroquine being used at 400 milligrams and below, and sometimes 450, it's okay. You also need to look at the political angle. A few days before that suspension was announced by the World Health, Donald Trump had just said that
he was taking it every day
for two weeks. So maybe they felt for somebody who is a prominent Western leader to say that people could, there could be another sort. So they just felt they should just pour cold water on the whole thing. But by and large, I think Africa is well suited for chloroquine trial. So my suggestion would be that the World Health should come to Africa, where safety concerns is not the challenge, and focus on that trial. And they should also look at the early stages. When people contract COVID-19, the first 4 days, is there any noticeable change when they take chloroquine?
Okay.
Because by the time they get to that point where the lungs has been taken over by the virus, and they start producing certain proteins they call cytokines that create severe inflammation, then you really don't get much from the chloroquine. So in essence, if you are doing a trial and you treat people who are at the advanced stages, you may get a result that is really not good. Even remdesivir, that people felt fairly did well in the trial by Gilead, a US pharmaceutical company, the death rate was still quite high. There wasn't much a significant degree, because some of these trials done at the late stages, patients used on patients at the late stages of the disease, really don't get results. So it's likely that the emphasis on chloroquine should be whether it's working at the early stages, at what concentration, and at what stage. If that can happen, it could be a game changer. Yeah, so the emphasis is to focus on those parts of the world where chloroquine has no safety issues, like Africa.
Which is Africa. We've been using it for a very long time.
So chloroquine is safe. If I were to even advise, Nigerian government should do its own trials, you know, conduct its own.
Which is what the DG of NAFDAC is saying that they're going to go ahead to
They should go ahead and then focus on the concentration, since most of the safety issues come from high concentrations. At least the one from Brazil, where the clinical trial was suspended, had to do with 600 milligram being used, and they stopped. But most of those who had reported no issue, Dr. Didier in France, Dr. Boua, University of Minnesota, who happened to be working in Africa too, for meningitis some years back, have said at 400 milligram, the chloroquine is safe. So if we could do that, that will help us.
So of course, in Nigeria now we can skip the safety, because we've always been using it, so we are fine with it. We know the concentration that works best for us. So the best thing is to go straight to. Okay, let me talk about the Madagascar. I don't know if you read about the Madagascar COVID organics, which the president came out to call a cure, which is not. That's the problem. Once you put the word cure, you've raised eyebrow. Look, what's that? So what is it about this COVID juice, this COVID organics, which the Madagascar, and it also has the artemisia annua, which is that's what it's made from, which is what we use to do our artemisinin that we use to manage malaria, you know, even to treat malaria at this time. So, is it a cure?
You know,
that's a very strange, but like a layman.
Let me answer it by making an analogy. It's not a cure. Generally, in science, for you to say something is a cure, you have to go through about 4 to 5 stages. First, discovery and observation, and then you do preclinicals. Preclinical means you are going to test it in animals and see if it works. Then you do clinical. That process is very, very rigorous. So you wouldn't say it's a cure. But what is going for the Madagascar people is that they are trying something they are familiar with. And there's nothing wrong in you trying something that you're familiar with. The idea that you have to, in a pandemic, get a cure before you use it on patients is wrong. One of the areas that the Nigerian government can exploit are their natural herbs that are endemic, that is found
within our own country.
Yes, that people have used to treat pneumonia-like diseases. That is diseases that affect the lungs. Are there some of those things? And people have noticed that some plants like dogoyaro or pawpaw leaves or garlic have some properties. So there's nothing wrong in you trying them, because first and foremost, they are safe, generally safe. Most people can try them. So what the Madagascar were doing were not a cure, but they were trying something. The president, not being a scientist, being a politician, felt he should promote it. So they weren't completely out of it. So what they can say is that maybe it's a nutritional supplement or a herbal solution that might provide some immune boosting properties. Yes, but we shouldn't just dismiss it because orthodox medicine, modern medicine, has not been. It's just 500 years old. The earth is more than 6,000 years. We've been using lots of this. Before quinine was ever used, used formerly as malaria, it's been used in South America for treating malaria. because it's got from a tree, the bark of a tree.
Yeah, of course.
And then, so you don't just say that you have a cure, but
they're trying something. They're trying something.
We should give it a try.
We should give it a trial, actually,
yes.
but not as a cure for now.
Not as a cure.
Okay, we're going to go on a quick break. When we return, I want us to talk about, how things to treat the pneumonia-like symptoms, and then, we'll talk about, this easing of the lockdown, how we're going to stay safe as we are unlocking. We are coming out of our homes gradually. So what we're going to do. All right, viewers, we'll be right back.
COVID-19 is not airborne. The virus that causes the disease is transmitted through droplets. When people cough or sneeze, droplets land on nearby surfaces that you may touch. Therefore, clean surfaces regularly. Avoid touching your eyes, nose, or mouth. Wash your hands with soap and water or alcohol-based hand rub. Maintain a physical distance of at least 2 meters from people, always. And if you are ill, wear a face mask to avoid infecting others.
Thank you for staying with us, viewers. Welcome back. Before we went on the break, we were discussing COVID-19, the reality and the future of it. And my guests are still Goodwill Owefi and Chidera Ezak. So thank you very much so far for the information you've been giving us. I'm sure we're passing out a lot of info out there. So now I want to talk about, you talked about the immune boosting, or the care that is given to people who are not, who maybe will notice the symptoms, or that's not the cure, because we know that at the moment cure is a heavy word to use. So what kind of things should we be looking at taking to boost immunity? And while I'll still come back to you on the discussion we're having. So
when you look at COVID-19, the challenge is the inflammation of the lungs. So you take note of the word inflammation. Okay.
So when you talk of inflammation, when you think of inflammation, think of fire in the heart.
Okay.
In the lungs. That's what the ordinary man will think.
Fire in the lungs. Okay. If you want to use a layman's language, or pain.
Okay.
Difficulty in breathing.
Okay.
The word inflammation basically means physical, localized conditions in different parts of the body that might elicit hot temperature, reddening, or whatever. So let's say when you have fever, that's inflammation. The body is reacting to something. So why is there inflammation in the lung? Because there are certain bioindicators that tell you that there's an inflammation. One of them is a protein called cytokine. When certain bad cytokines are produced, then you start having inflammation of the lungs.
So the problem with COVID-19 is not necessarily the virus, it's the response of the body.
The response and all the complicating reactions that follow.
All right, okay.
So if you could put those complicated reactions in check, people don't die of COVID.
Yeah.
Okay.
They can have it and survive. And that's why young people are surviving, because they're able to weather the inflammatory responses. So the question is, are there natural plants or drugs we know that have a lot of anti-inflammatory properties? Already we know that garlic has one.
Okay.
That's why most lay people are preferring to take garlic now. Ginger also has anti-inflammatory.
Okay.
Lemon has anti-inflammatory.
Okay.
Most vitamins, like we talked about citrus plants, lemon is a citrus plant, orange and all that, they all have different. Vitamin C is also an anti-inflammatory, anti-oxidizing vitamin. But they perform different key roles in the body. If we could encourage people to also take that, normally not in excess, just the way they take them.
Okay.
Ginger
the lemon
tea.
one, maybe with hot water, because I don't know if I want to put
Just normal lemon.
How do they prepare lemonade?
Okay, all right, okay. Because I'm just thinking hot water and then you slice the lemon.
Yes.
It still gives you the vitamin C, isn't it? Because I don't know about liquid.
Just squeezing
but
wine.
that just means speaking out of
Yes.
yeah, please carry on.
So if you can prepare lemonade, fine. If you
Okay.
can use hot water, fine. If
Okay.
you, but most people know how they do it locally. Ginger, garlic. Your immune system will improve. In
Okay.
fact, I had a colleague who said, "Sir, I started taking garlic, and I feel as if I'm weightless. You know, I'm feeling lighter." I said, "Wow, that's a detoxifying effect, because your body feels as if things are just going
Coming
out."
out
Yeah.
of it, yeah.
So once you can bring in those natural materials, fruits or plant materials that can have anti-inflammatory response, then the chances of people dying may be reduced. And that's why you see most people are saying people are taking ginger, because these are, in science, when you make a personal statement of something that worked for you but has not been established by the science, but they call it anecdotal evidence, because it's purely based on your personal experience. It's not based on a large data. Yes, for you to make a scientific conclusion, you need to have a large data, and you're talking about hundreds and thousands of patients to work with. So based on the anecdotal evidence people have observed, they felt some of them improved. Government can decide to say, take it from there and say, okay, we have departments, nutrition and dietetics department in most hospitals. Why don't we produce something that all the COVID-19 patients can also take?
Okay. So,
like a supplement.
all right.
If I bring in experts in nutrition, dietetics, and so on, and say, okay, provide a blend, a juice blend of ginger, garlic, and while you're taking care of the COVID-19 patients, why don't you give them a little? Because we know generally they are safe. People take them.
Yeah, take them every time.
There's nothing wrong with that.
Okay, so we need to then take advantage of our people that went to school to study some of these things.
Yeah.
Come on now
Yes. And do something.
To do something.
And,
Think up something.
and interestingly, most hospitals have those
Have those
departments.
departments. Okay.
So they are not cure,
yeah, they're just to manage.
but they are known
the
to be
symptoms.
they are known to provide anti-inflammatory
Anti-inflammatory.
responses.
Okay.
Yes, so that can help. What happened with COVID-19 also happened with COVID.
Yes,
300 years,
yeah,
400
we
years,
need to
where
find just a little concentration of
Vitamin C.
could help, you know, and the scientific world didn't take it serious until conclusively. But those who were trying out those things, trying out the use of fruits to help cure COVID, were in wrong. You can't wait till when you have precise science to take steps, particularly on things you know are not necessarily harmful. You don't need to do toxicity of garlic.
Yeah, garlic.
You don't need to do safety of ginger. You don't need to start doing whether 400 milligram of lemon will.
But would you advise, can you get to a point where you have excess of it?
There might be.
Just take the normal quantity. Don't take too much.
Don't
of
take
it.
too
You
much.
know, take it and think that's what will wash your system and make
No,
it pure and against the attack of COVID-19. But just before we go on, I wanted to bring you up on the safety issue. You know, we're gradually easing off the lockdown. We're gradually, you know, governments globally. I think maybe in the next week or so, Nigeria as well, we've eased off a little, and I'm seeing a lot of people outside, and over very soon I'm sure to be open. I've seen other countries that have really opened up their country, you know, to work and all of that. We can't keep staying, just as you said, we can't keep staying locked in. We must move ahead. So what kind of things should people be mindful of? Even though we have seen that, of course, you can start taking these things to help, but you can take them just before we move. You can take them not necessarily when you have symptoms. You can take it on your own without regularly.
Yeah, so most people take, a lot of people take ginger tea. I don't take, but I know a lot of people who do. So, but And I started learning how to do the same too. You know.
I don't know about garlic, but I can try ginger.
Yeah. You
All
know.
right. So, what should people be doing now that the lockdown has been eased off?
Okay. I'll say do not dismiss what the previous regulations that have already been in place. Example, the use of sanitizers and washing your hands.
Just washing your hands. I had a guest every time, and he was trying to explain it to me. They keep telling people wash hand. I know it's prevention of so many illnesses. If you wash your hand, you don't put in sickness. For every, you can wash your hand when you come back from prison. But is that all? Is it doing anything in particular? Does washing of hand, does it have the ability to kill coronavirus?
It does have spread because we easily contact infections, germs on our hands. And what happens when we take them here? And some of the openings to the body is nose, the mouth, the eyes. So the whole idea is to ensure that, let's say I touch the surface and corona is on my hands. I get home and I wash my hands for, let's say, 45 to 1 minute, for 5 seconds to 1 minute. The chance of me transmitting that virus is almost zero now. So gone from 100% to zero. But let's say I don't wash my hands. The next thing is I touch my face, the viruses go into the nose, the eyes, the mouth, then you have a problem. So the whole idea is most infections that we contract come from what we touch, and then we then touch openings in our body where those microorganisms can then go in.
Also, the coronavirus, say like the makeup of the virus has sort of like a lipid bilayer. So normally, the emulsion between soap and oil, sort of like we see normally, when you want to wash your oily plates, if you check when you put soap, it's easy to wash off with water. So the use of soap with washing hands, that they are like amplifiers that are found in soap. So they sort of mimic the lipid bilayer. So they go into the lipid bilayer and create like pores and holes to destroy that bilayer, the integrity, not basically kill it off, but then just if it was in a circular form, they make it to be like a line basically, so it's easier to wash it off when you now rinse your hand in the water. So it is basically the safest means of getting rid of the coronavirus from your hands, so as not to put it in your eyes or your mouth or touch it, especially if you're not too careful with touching your face.
So if you're a mother or a father and you come back home, the importance of washing your hands before you touch your kids. The kids they might never, 2 or 3 years old, they wouldn't care less about washing their hands. Okay, what else should we look at? Okay, washing of hand now. Yeah. So we know that it's safe if you wash your hand, you don't get it into your mouth, or it says men, so it's mouth,
eyes and nose.
So that you don't get it in there.
Okay.
And of course it destroys integrity of the form of the virus if you wash your hand. Now the sanitizer is the alternative.
Yes.
It's not necessarily when you see water you use sanitizer because you're lazy washing
it happens a lot, honestly, without you even realizing it. You're like, oh, there's sanitizer. Just use the sanitizer because you don't want to go through the and then going into your fingers and doing all that, the methods. But then I would advise that anywhere you see water, even after you have used the sanitizer, please wash your hands. It's not like the sanitizer is not enough, but it is safest to use the water and the soap to wash your hands.
Nose mask.
Yes.
We keep wearing it even in the house.
Honestly, I think it has come to a time right now in the world where I think nose masks will be a fact and a phenomenon right now. Yes. I'll say that in order that you don't get to use nose masks all the time, especially if you are very uncomfortable with it, please stay away from crowded areas, because the reason that you have nose masks is to protect both parties, that's you and the other person. But in a case where you are secluded from crowded places. Maybe you're with people who like your family members now, that's staying indoors when you don't need to be outside. That way you won't get to wear nose masks all the time and complain about the discomfort that it brings, because it does bring a lot. I can say myself that I think this is a time maybe that I've not worn face masks in like the whole of today. I've been on face mask, and it's actually makes you tired without knowing, because you're not taking in a lot of oxygen as you would want to. And also, with the work that you're doing, your brain is using up the oxygen, and you're not getting enough, so you get tired. Sometimes I even question, I'm like, I hope I'm not. But then at the end of it, or when I get home and I've taken a bath, washed my hands, I just realized that I feel better all of a sudden because I've taken off my mask. Yes, so things like that. And
so the thing is, if you're not in a crowded area,
yes,
or so you might need to take off the nose mask.
Yeah.
Now I know that I read the other day, and a lady died, using the nose mask to exercise. Because when you're exercising, you're using a lot of oxygen. And I go on the street and I see people, when I'm taking my morning walks, I see a lot of people, covering their nose, and they will bring it out, take air, cover it because they're gasping for air. I don't think that's...
When you're exercising, your muscles are actually, taking up that oxygen, because it's especially jogging. That's an aerobic exercise. That means there's a use of oxygen. If it was anaerobic, then maybe we would not be talking about. But this is consistent use of oxygen. You need it. So if you're not taking in a lot, there's a probability of hypoxia, and because oxygen is needed, that can actually cause fatality without you even imagining that it will happen to you. But in cases, I would say when you're jogging, make sure, or when you're exercising in general, not just jogging, when you're exercising, just be sure that you are away from people. If possible, if you come in contact with maybe a crowd of people coming, when I say crowd, I'm not talking about 50, I'm talking about even 3 or 2. When you see those people coming, you can actually wait for them to pass, but just try to be alone so that you can not use the mask and get the amount of oxygen you have.
We also talked about safety in the office. Now we're going back to the office.
Yeah, I was trying to expound on the supportive care that Mr. Godu was talking about. I said in this time and era where we have to deal with viruses like this, to be of good that the offices, be it government, be it private, wherever you're working, should put in more effort in occupational safety and hygiene, because this is lives we're talking about. If someone comes down with anything, malaria, cold, make sure that this person takes a day or 2 out so as not to infect other people. Because if we had started with that kind of behavior, the spread of this would have not been contained a bit. Because I know as Nigerians we say, oh yes, we still need to go to work, I'm strong, I still need to move. It's not about you. If you look at it as just you would actually miss it. You need to look at the other person, how they are going to be affected, things like that. So I think as we're easing down this lockdown, offices should take notes. You see anyone who complains of having a cold or anything, just let them off 2 days a day so that they can get themselves back and be more productive to you at work.
This reminds me of a particular time, I think in my sister's office, and all of them were coming down with diarrhea. And she was telling me, it happened to this person, it happened to this person. And I said, is there anything you people are doing communal? Is there a place you people meet? They realized that the dispenser, they hadn't cleaned it.
Wow.
For I think maybe over a year. So now, and I said, okay, check something that you people are using. So when she went, she said, okay, let's see, and this is still how awful and filthy dispenser was, and that was the end of this area. So if you're going back to the office, some of these things should be considered. Just adding to what your offices should take measures to ensure safe. The toilets, educate people. It's not time to finish it in the toilet and leave it.
Yes.
If you can clean it for other people, good. If you take a wipe and wipe when you're done, so that somebody else can be safe.
We all really need to step up on our hygiene.
As we're returning. Now, it's not about you. You might be fine, but consider somebody else. Because if you infect somebody else, they could come back to infect you again because we're all in the same office. I'm running up the program. So do you want to add to that?
I think going forward, I think maybe globally, our global response to things should be early.
Our response should be early.
Had the Chinese been a little bit forthright earlier, it wouldn't have spread. So I think there should be focus on setting up a global task force that ensures that even when the politics, we come from different countries, when you have a disease coming from a particular part of the world, that immediately we begin is intensive containment. Containment means to cordon it off, that place.
Yes.
They don't travel out again. They should stay there for now.
Because most of the, once you've let a virus that is respiratory out, it's difficult to put back. Then, like we talked about, hand washing is a standard public health tool.
Yes.
It's not just for COVID.
Because before now, they were teaching children. Most of the brands had gone out to start teaching people how to wash hands.
Yes, because when you, it's a common thing that if you wash your hands, a lot of infections, we typhoid, diarrhea, most of them come from what we touch that contaminate our hands, or our hands then taken. While we're eating or something.
I know we eat a lot with our hands.
So we're going to focus on, go back to basics. Hand washing.
And even the parents should train the children to imbibe the habit of hand washing.
Yes.
Because kids these days just dust their hand and move on to something else.
Yes.
But to imbibe the culture of hand washing, very important. Even after COVID-19, let's say in the next couple of months or a year we're done with COVID-19, hand washing is still a major preventative
tool for any infection that can spread from human to human.
Another thing that's important is the thing we've talked about, the ginger, the garlic, the vitamin C, the supplements. Do we need to take the supplements as well?
No, they're all supplements.
They're also
anything you take that can help boost your immune, provide essential vitamins, are generally considered supplements. So if people could just eat well, this also applies to people who have cancer. There are certain kind of foods you could eat. It reduces your it helps boost your immune. You have a Crohn's disease, something that affects the intestine. You take the certain kind of food you eat. The same with something like this. If we could talk about the anti-inflammatory properties of fruits, of plant materials that are very common around us, it will go a long way. They are not a cure, but they do play very important roles. And those roles, if if you shine a light on it, talk about it, can really go a long way.
Maybe I'll bring you back on the program. Let's do a thorough discussion on this fruits and vegetables, because I believe in that 100%. I believe in that aspect of medicine. Thank you very much for coming on the program. We have talked for a very long time. I believe that we've been able to disseminate a lot of information out there to our viewers. So thank you so much for coming on the program. For the past couple of viewers, thank you for staying with us. And I've been speaking to Goodwill Ogwefi. He is a public health analyst and he's been on the program. He's given us a lot of information today. Thank you very much. And I've also been speaking. I've also had Miss Chidera Ezaku. She's a biochemist with a master's in public health, and she's presently working with the FCT COVID-19 response team. And that's the public health department. Let me be specific about that.
Thank you.
Thank you for coming on the program, and we must really salute you for the work that you do. Thank you very much.
Okay.
And that's all we can take today on the program. I'll see you next time. God bless you. I'm Angela. Goodbye.